Hi, I'm Dr. Mark Studin, and I'm here today with Keith, who's one of our business partners, actually, who gave me a call a few months ago and said, I saw your list online of trauma team members, and I've worked with one of your doctors out west. And Keith, good morning, Keith.
Hey, how you doing today, Dr. Mark?
I'm doing fantastic. Now, Keith, out west, the doctor you work with, who is one of our trauma team members, if I'm correct, you've exposed him to about 900 referrals per month through the hospital systems that you have relationships with. Is that correct?
Yes, sir.
Now, what are you looking to do around the country and why?
So, in our business, we've realized that really chiropractics is the solution for what we do as a business organization. And our vision is to roll this same program out nationwide. That's why I contacted you. That's why we're having all these discussions. And we've got how many? Five right now that we're working with or starting to work with that are part of your trauma team. And we want to take it nationally. And currently, we have a massive footprint nationally. We have contracts with major hospitals and ER centers, so surgery centers tied to the ER, and you've created the perfect program.
Well, thank you, and I appreciate that. So, but why are trauma team members? What makes that so special?
Okay, so if we're working with, we love chiropractors, but there's a huge difference between chiropractors that we've worked with and your trauma team members. They understand all the nuances of dealing with the neurosurgeon and prepping that patient so that the neurosurgeon is seeing patients that are really qualified to see the neurosurgeon. And we love that. It works perfectly.
So again, it's not just the neurosurgeon; it's the orthopedic surgeon or the interventional pain management, any type of interventional process. So you're looking for the chiropractor, if I could paraphrase our last 50 conversations, to pre-screen these patients before they get to the surgeon and allow the surgeon more time in the operating room by not having to waste their time on non-surgical cases.
Absolutely. And the patient flow is significant. The
Yeah.
surgeons, in fact, you don't know this, but I just sat down with one of the surgeons here locally, one of the neurosurgeons that's in partnership with one of your doctors. And we sat in the lobby and visited. And this was when he's in clinic at the hospital. And I said, "Man, you're pretty chill today." And he goes, "Yeah, I'm seeing the right patients. I'm pretty chill."
That
So
that's awesome. So when you say you want to roll this out nationally, so what you're saying is you've already seen our list of trauma team members. There's about 90 right now, and it's growing. So what you're saying is that you have the ability through your organization to really do this anywhere you want in the country, and you want to tailor it around our trauma team members and our doctors that we train through the Academy of Chiropractic to be the point for your entire model. Is that correct?
yeah, exactly. We need that primary spine care doctor. We need the person that can assess a number of different different issues that they may have experienced through an auto accident, for example, and be able to order the MRIs and get things happening, and then say, you know what, we need to get you to see the orthopedic. We need to get you over to the pain guys. So our doctor is the quarterback and the one directing care because we don't.
Right.
We come in and we take care of the economic side of the arrangement, and we let the doctors on your team coordinate the care.
So, obviously credentials matter, and
Oh,
it's just been working really well. So, you mentioned primary spine care, which is great because our doctors can get qualified in that. They can get hospital qualified. There's just a lot of different areas, and for me, the mantra has been, hey, the smarter you get, the more credentials you have, the more opportunity there is for you. It's just that simple for any willing provider. There's no politics involved. There's no cronyism. Anyone who wants to do this is on board. Just
Oh
simple.
yeah.
Got to do the work.
Yeah, and I'm just going to tell you, your program changes lives, period. So the doctors that we're working with that we've met through your program are so far advanced. I mean, just looking at the MRIs, we had one case, just so you know, last week, your doctor here said, "Oh, Keith, I just reviewed this case. The MRI came back. The radiologist at the imaging center didn't find anything. But look," and he showed me what the issue was. And he said, "So I called the radiologist. I said, okay, pull up the images. Let's look at this area. Do you see bulging? Oh, yeah, actually I do. Okay, let's document that." And he found two areas, because he's certified and trained through your program, that the radiologist missed.
Hmm. Well, that's what we train them for. So I had, oh crap, there was one other question I had for you and I forgot, just flew right out of my head. Man, I'm getting senile. So, all right, so listen, Keith, thank you very much. I really don't want to make this very long because, people's time is valuable, but I look forward to, to breaking this out throughout the country with you and helping a lot of people. And, everybody can make a lot of money through quality care as a byproduct of quality service. And that's really what we're about. Keith, thank you so much. And maybe we'll get to chat again. You have a great day.
Hey, you're welcome. Take care, Dr. Mark. Bye-bye.